Good afternoon. We have with us Dr. Jitendra Sharma, Critical Care Specialist at Artemis Hospital, Gurgaon. Doctor, during this time, we look forward to your expertise and we welcome you to Natco Pharma Specialty Criticon 2024 studio. What we want to hear from you is the advice to the young generation of doctors in the space of critical care associated with antibacterial resistance. I'd like to ask the first question is, how do you foresee the changes in critical care management?
First of all, thanks to Natco for having me here, and special thanks to you, Vivian, for asking us such an important question. What we will see, foresee in the coming years in the medical, there would be a radical change in the medical field, as we are seeing in the technologies fastly entering into the every field. Similarly, the medical will not be left behind. Artificial intelligence has already entered, but it will take more their share in the, especially in the critical care. And we move from, like we have seen, we moved from the empirical medicine to the evidence-based medicine. Now we will see the movement of the evidence-based medicine to the precision medicine, where we can directly, with the help of technology, we can really see the what is the assessment of the patient, what is the monitoring of the patient, what is the treatment option, and how precisely it is acting on the patient. That would be a drastic change in the medical field, and the critical care is bound to have these changes.
So technology is definitely going to be of very, very useful, I would say, in
Yeah,
critical care
apart from
management.
technology, it would be a artificial intelligence. They enable, or we can say that support the clinician to take the decision. So till now we are having a technology to really monitor it and give us some kind of a suggestion. But after that evolution, we'll see the directly entering the technology in the decision making and simultaneously reduce the errors as well as the remove the variation in the one clinician to the another clinician.
I think we need to see that day soon. My next question to you is, what is your advice for the young ICU doctors to enhance patient care?
I would say they will be fortunate enough to really witness this drastic change. They will witness it. Simultaneously, there would be challenges for them. They will feel, this is my opinion, they may feel always a knowledge gap because the technology move more faster than the what knowledge they are acquiring. So all the time they feel their upgradation in the knowledge, they have to adopt the new technology, they have to adopt the new skill, and possibly whatever the basic training they underwent in their medical education looks like inadequate when they start the practice. That would be a major challenge for the newer generation. Second is emotional management. Gradually, like our older age, emotional component was more in the medical care. Gradually shifted towards the technology, and the furthermore, all the precision medicine will treat the patient, but the emotional component appears to be lacking, and they have to work upon that.
Do you see a connection between education of today with technology?
Yeah, it is being happening, but not a that magnitude which I can foresee. There would be appears to be all the time gap would be there.
Okay. My final question to you is, what is the prevalence of carbapenems producing bacteria in your practice? And what is the best treatment options?
So carbapenem resistance, as I recollect the incidents in our ICU, we are having a medical ICU, mixed ICU, along with the catering, the solid organ transplant, as well as the hematological disease. So we quite often see a significant incidence. If you really want a number, somewhere ranges from the 15 to the as high as the 30% of the isolates which we are sending. So that much of the variation in the incidence of the carbapenem resistance bacteria or gram-negative sepsis. The best treatment, again, there may not be a one size fit for all kind of this thing. Is, as I told you, there would be a precision medicine would be there. So most probably, first thing is we really differentiate whether it is a colonization or really harming the patient. That would be a first responsibility of the clinician while dealing with this. And the second is, despite the preventive aspect I am talking about, then I'll come to the treatment. Is the preventive is like a restriction of the antibiotic or antimicrobial receivership. They will help. But even you can't remove completely eliminate the resistant bacteria, because the advancement of the science and the clinical practices, we are keeping those patients alive. They are very risk for the colonization of these bacteria, and with the advancement we are keeping those patients alive, so there would be always some kind of incidence of the carbapenem resistance bacteria. That is related to the prevention. And the treatment part, definitely we are having so many weapons, so there would be advancement of the weapons like a newer BLBLA combinations, newer cephalosporin would be there, and along with the strategy is again important, and how they are working, the efficacy over there. If we really know what is the therapeutic drug monitoring is there, so we really know how the one patient is different from the another patient. Same dose may not work for the a B patient, which is working for the A patient. So all are the strategical changes also required, not just for the one agent, which will be helpful for them.
Dr. Jitendra Sharma, I like your insight, or rather, I would say the foresight into, the technology and artificial intelligence coming into critical care. And I thank you so much for your time here at the Natco Pharma Specialty Studio. We wish you all the best in your